Hello, everyone. Welcome to TALRadio. This is me, RJ Saankhya, hosting through the interview today. In this show is where TALRadio proudly highlights extraordinary organizations and the remarkable individuals behind them. So today, we try to bring spotlight on this wonderful organization which is making a huge difference in healthcare sector. CommonWell Alliance. It is a non-profit organization revolutionizing healthcare through seamless information sharing. CommonWell Alliance empowers healthcare organizations to deliver improved care outcomes and enhance patient experiences by enabling seamless information exchange. And they are creating a future where healthcare providers can access critical data at the point of care, leading to more informed decision making and ultimately better patient outcomes. So, to guide us through this wonderful organization today, joining us is Mr. Paul L. Wilder, an exceptional individual who has dedicated his career to driving positive change and transforming healthcare interoperability. And as the executive director of CommonWell Alliance, Mr. Wilder's remarkable leadership has been instrumental in revolutionizing the way patient information is shared and improving healthcare outcomes. So, before we get into this talk, let me welcome Paul. So, hi, Paul, how are you doing?
I'm doing great. Thanks for having me here.
Thank you. Thank you for taking time and coming here. So tell us a little bit about your background and how you landed on this profession.
Yeah, so I've been in healthcare, I've been in IT my entire career, but with a small diversion into some commercial building stuff. It's hard to explain. But most of it IT, and then most of that in healthcare IT. And it actually is easiest to explain why I'm here when I explain that brief little time that I tried to leave to see what else is out there and why I came back. My daughter was born while I was just outside healthcare IT. I was doing healthcare vertical stuff. And we had a near tragedy. It actually wound up being fine. And hopefully I don't get too choked up. But she got born in New York City. And we lived just across the Hudson River in New Jersey. Everything was fine. She was actually quite early. I got a little jaundice, blah, blah, blah. That dissipated. We came back home and we saw her primary care, her pediatrician. And the jaundice had returned, which we didn't really quite notice was happening. But the doctor said, hey, by the way, your daughter's a little jaundice. I'm like, yeah, well, in the hospital she was, and it dissipated. He's like, oh, wait a second. This doesn't usually dissipate and then come back. Something could be wrong. And we got whisked off to the hospital. Well, we whisked ourselves off to the hospital with a stroller down the street. And what was interesting and sad and tragic all at the same time was the amount of tests she went through again, including a spinal tap. Things that you and I would think would be incredibly painful. That fortunately she does not remember. Thousands of dollars of tests, pages and pages of tests. Almost all of it had been done already because she was an early arrival baby. At the hospital that was by bird's flight distance, probably about 3.5 miles away. But they were completely unable to get the data from the one facility to the other because they described the data as being between floors, which literally means it was on a cart between two floors, and they didn't know where the data was. So they had to redo everything, which is inefficient for healthcare, is torture for the parents. Everything is wrong about that. And I said, okay, I got to come back. Someone's going to work on this and work on it aggressively, because that was a near tragedy for my daughter, and she's perfectly fine, and she's a great kid. But the inefficiencies and everything else that happened in healthcare that we saw firsthand, I was like, I know I can work on this. I know how to get back in, and I'm back. So I came back pretty quick right after.
Wonderful. I'm sorry that happened, but it's really amazing how you're trying to make a difference in it right now. So can you provide us with an overview of CommonWell Alliance mission and what specific challenges does CommonWell Alliance aim to address in the healthcare industry?
Yeah, so after I moved back in healthcare and I was working on interoperability, what I was working as a thing called a health information exchange. And what they do is connect providers to a central hub/repository and warehouse to collect all the data, the longitudinal data about a patient, and have access to it as well to help providers make informed decisions. But what I found there that was lacking, and is in some HIEs, but not in all, is it was a second source of data. It wasn't the primary tool that the provider was using. The electronic tool was the electronic health record, the thing that was in front of them. That's their productivity tool. And to get to this treasure trove of data, they had to leave that tool and go to another. It was disjointed workflow. And what CommonWell did was very appealing to me. It was built 10 years ago. It was almost 10 years and 3 months, so 2013. And here the philosophy was different. It was the vendor product needs to integrate the core functionalities of interoperability. It needs to be a part of the workflow of the electronic health records, kind of like you need your calendaring system to be with your email system. When they're separate, things go awry. And inside, you have all the interoperability workflows, but you still need an edge. It's not a single vendor or single provider solution. The idea is you have to connect other things. So CommonWell was formed by a couple like-minded vendors that said, hey, you know what we got to do is we need to do interoperate. And that means putting in the productivity application. But two, we need to do it right for the market and realize that it's not just our customers, it's you, my competitor, your customers too. We all need to interoperate. So let's work on that edge protocol so that the data can flow not just amongst my customers, across your customers, and we can build better workflows as time goes on. And now we have about 35,000 clinical sites connected and about 210 million people represented in our system. So it's working. We're moving, hundreds of millions of documents a month now between providers. Still a lot more work to do, but we've come a long way.
Wonderful. So can you tell us how exactly can someone access the service?
So the access, the primary access is for the healthcare provider. So for provider, and I was just at a presentation this week where a bunch of providers and health executives were in the room. So how do I get connected to you? This thing sounds wonderful. As it is pretty wonderful. And the first call you make is to your vendor. You call your vendor and say, am I already connectable? And then they find out in many cases that the product they have already has this capability underlying. They just need to be trained on how to use it. The second way is we say, look, if you have a vendor that's not connected, call us. And the reason why we're vendor focused is we want to get to scale. You look at that, the example I gave of the health information exchange. They're connecting one provider at a time, and it's a very expensive process. It's a very long workflow to go through setting up interfaces and electronic transfers and all this stuff, security, go down the list. In our case, it's embedded in the product. So when a provider raises their hand and calls their producer of their technology and says, turn me on, it is a flip of the switch. So when we find a provider that has a vendor product that's not connected yet, we say, we'll talk to the vendor and explain why they want to do this for you so that they can then bring it to all the rest of their customers. Because it's a build once, wash, rinse, repeat. Just keep adding on other ones by flipping those switches. So it creates the scale we're really looking for. So the first thing is, buy a product that has this underlying technology in it. If not, call me, email me, paul@commonweallalliance.org, and say, how do I convince my vendor to help me get on this highway so that I can be a good interoperability steward on both sides. I can get data as well as, give data back.
Great. So how do you want to mention any notable partnerships or collaborations that CommonWell Alliance has engaged in to furthering its mission?
Yeah, so actually that's a very, very good question and angle here, because, I talked about, we have these like-minded vendors who built a system that said, hey, we're not the be-all end-all. Not every customer in the country is going to have our product. There's going to be competition and we welcome it. The reality is once you build a network that has that mentality, you also have to recognize that the network may not be the be all end all, right? So it's not going to be every vendor in the world connected to CommonWell. So we connect to, I consider all my members partners and they're partners with each other. We create this, we really are a community. Like there's a technical stack in the middle, but it really is a community that, believes in interoperability and wants to make things work. And so we sought out like-minded frameworks and networks that do the same thing and have the same goals and objectives. So one of them out there right now is this thing called Care Quality, and they are not a network. They don't have the technical infrastructure we have that knows that where those 210 million people's where their data is, but it does provide a directory and a set of policies to exchange data across another set of vendors. So back in 2018-19, we signed up with them to be a partner with their network. And now today, there's an even bigger effort from pushed by the government as well as industry, so kind of a public-private partnership called TEFCA, which is TEFCA, or the Trusted Exchange Framework and Common Agreement, which is connecting all the broader networks together. So think of this as almost, putting the plumbing in place to have universal exchange across the country. So my vendors believe it's not just them, it's a network that needs to do this. Our network believes if there's another network, we don't need the providers and the products over there to convert to be members of our alliance. We'll connect to each other. So there's no pride of authorship or technology ship here. It is a village of villages, and it takes a village to make healthcare interop work. It takes a village to make healthcare work. And we're excited actually to connect to those other partners, which has about 6 other frameworks or networks that are also expected to participate to connect the entire country into a massive healthcare information superhighway.
Great. So, as an executive director, what is your vision for the future of healthcare interoperability, and how do you see CommonWell Alliance continuing to make an impact in the coming years?
Yeah, now's the downside, right? And this creates the vision. While we're connecting a lot of providers, and we probably have between us and our partner framework participants about 80% of the data of healthcare available across the country, which is pretty substantial. We unfortunately are victim to the 80-20 rule. That 80% of the data is coming from about 20% of the connections that are available. We are a little top heavy, right? We do the bigger hospitals first, the larger specialty and primary care practices, and there's thousands, tens of thousands of other providers out there that are not connected. Just giving some numbers, I mentioned 35,000 sites. If you actually look up data available on the internet from government does a survey actually called the physician study, ambulatory study. There's about 210,000 clinical sites in the country that are not hospitals, and there's about 6,000 hospitals. So when you take our 35,000 and the other 15,000 available through our partners, you quickly realize that we have about 50,000 covered, but there's another 160,000 to do. So we have more outreach to do to get the smaller vendors and smaller providers to onboard and get moving. And I think the vision for the future is to finish that. And that's probably a 5-year job from here. It took us 10 years to get this far. It'll take a couple of years to do the rest. But more importantly, the next step is to get other users plugged into the networks to allow new use cases. And the primary is you and I. So this network right now is very provider focused. It's a provider sharing data about you with another provider. It's very secure. It's under HIPAA. All that's true. But we need to get the patient engaged more. Let's get them involved with their data, both to help them manage their healthcare, but also just as an error check. Just like you should have access to your credit card statements to see who's using your credit card, and you should look at that once in a while. You should look at your health data once in a while and make sure there aren't mistakes. And there aren't big mistakes being made that as often as that it might be in the press, because those stories are interesting. But small mistakes do happen all the time. And as we move into a more connected world, as we move into AI making more decisions and helping with analyzing data, it's going to be more and more important that our data is, 1, complete. So let's finish connecting everybody. And 2, that there's no underlying data errors underneath, or some bad things can happen by accident. So I think you're going to see more connections, and you're going to see additional use cases and users, hopefully the primary being the patient themselves.
Great. So since you were talking about data, how does CommonWell Alliance address the challenges of data security and privacy in healthcare information exchange?
Yeah, data privacy in healthcare has a relatively long history under HIPAA to make sure that data is secured in transit. As well as that there are rules if data is accidentally revealed to the wrong party. So we actually don't have a major problem with provider exchange. It is, and they're all relatively secure. We are high trust certified, which is a relatively high bar test beyond SOC 2 and other things that people do that confirms that your data is both maintained properly, encrypted in transit and rest, all that stuff, but also that you have the policies in place to properly authorize users, even policies on how you do finances to make sure that you're not a going concern, that that you're going to survive and exist. I will say that once we cross the P's, and I mentioned patients, but we cross from provider to patient or provider to payer. We call them payers. You could call them health insurers, or provider to public health, or public health to payers. Anytime you cross these things starting with the letter P, it gets harder because the security requirements and the security standards do change. And the challenging one right now is getting provider and patient to cross at scale. You probably get data from your own provider, your single provider, through their portal, through a credential that they provide to you. But connecting to all the providers at one time is a little bit different. Under HIPAA, if a provider sends your data to the wrong provider, there is practices in place where the provider that wasn't supposed to get your data knows that they're supposed to delete it, shred it if it's paper. There's a rule set on what happens when the wrong data goes to the wrong person. When my data goes to the wrong individual, another patient, those rules don't exist. They're not as strict. They're not as clear on what's supposed to happen. And we don't want people's data going into the wrong hands. Usually those wrong hands are an accident and it's fine. But if it's not an accident, it's intentional, and we're getting closer to identity stealing and the like, we do have to be more careful. So there is a challenge here in our way, getting from providers to patients. And the main thing is about ID management and making sure you are who you really are when you make a request for your data. And that bar is being lifted as I speak. And I'm pretty excited about the fact that we are moving that bar to get to more universal access by the patient themselves into these existing networks. So security is a big deal for us. And part of the reason why provider to patient isn't working at the scale it's at is because we are very cognizant of the pitfalls and the things we should be doing to make sure that data exchange is secure.
Thank you for sharing that, Paul. So could you also share some success stories or examples of how the organization has improved patient care?
Yeah, I mean, you don't have to go much further than myself. I found that in healthcare, no one's well all the time. And if you observe what's going on and you have a data brain, if you're an IT type, you can see where things have helped or where things have hurt. And in my example, I had some level of asthma. I call myself a functional asthmatic. I used to run marathons. I probably could train for one again, now, and didn't probably get out and do one in about 6 months. Never knew as an asthmatic until I had some other issues that someone said, see a pulmonologist and get checked. Fast forward, about a year ago, I had an eye issue with one of my retina that required me to reduce some of my asthma medication. And when that happened, I wound up having a severe asthma attack, wound up in the emergency department. And I got lights and sirens and an ambulance and everything. And when I got there, the first thing they do to see how bad of a state you're really in is they take the oxygen off that they've been giving you in the ambulance to see if you can speak, how responsive you are, et cetera. And I really crashed. I went to a really bad state really fast. And I went from being able to talk to the providers and answer questions to being able to just say one word. And then it was just one syllable words like yes or no. And then it was truly just being able to shake my head up and down or left and right to say yes or no visually, because I just could not get enough air in to speak. And fortunately, on the screen was my medication history, and they were able to ask me questions. Are you still taking the Brio? Do you have a rescue inhaler? It shows here that you recently refilled it. And I could nod yes or no to explain some of what happened to me that day, as well as my medical history to confirm or deny what medications I was currently on and how I was doing. So that helped them diagnose me faster, get the steroids that were necessary for me to start to recover. And then we could start figuring out the clinical workup from there. But I had to be stabilized before I could do that. Without that data being available, I'm not sure how that episode would have gone, right? And the speed at which they could have helped me go from a very serious situation to a stable situation to being a functional, properly controlled asthmatic again. I don't know if I would have died, but I think I would have been in much more harm than I would have been without that data available.
Thank you for sharing that. So what are the different ways individuals can get involved with organization and contribute to its mission?
Yeah, so getting involved with our organization as an individual is a little strange, just because we are vendor focused. We're called a 501c6, which is a trade alliance association. So we're more designed for the vendor community. That said, we do have individual providers that are members. It's expensive to join as an individual, but we have healthcare providers. More importantly, though, is stand up for your rights to get data, talk to your providers, and remind them that data is important. You trust them, and you want to see them be better providers. The reality is, if you look at the primary care in particular world, and a little bit of the specialty, providers are in a lot of stress right now. There's a high volume of transactions. There's a high volume of visits. They have very limited amount of time to work with you. And some of them don't know the tools that are available. So as a good steward of interoperability and healthcare data, I'm constantly asking every provider to use the digital tools before they start doing things like using paper. When they had me a folder with my data printed out, I say, is there a way you can email that to me? And they'll say, well, we can't just do an email because that's not secure, but we could do a secure email. Or if I'm transitioning to another provider, can you send it over to them via digital, by direct versus me carrying these folders over? The more we encourage the connected stuff to be used, the more it's useful for the provider as well as ourselves, as well as our payers. And we have to get everybody used to a digital connected healthcare world. It is very connected right now, but we could use more usage. And I think every day we can remind our providers that as patients, we're comfortable with them using that. We're actually less comfortable. Probably most people listening to this are going to be less comfortable with getting the paperwork because they're not sure what to do with it, and would rather see the digital stuff be used in a secure and privacy controlled way.
Great. So lastly, before we wrap up, looking back on your journey with CommonWell Alliance, what accomplishments are you the most proud of, and what legacy do you hope to leave behind in the field of healthcare services?
Yeah, I mean, the thing I'm most proud of, we've grown, and since I got here, probably tripled the number of connections. And I think some of that was going to happen on its own because, once you get past a certain level of adoption, things start to go faster. What I am most proud of is we added patient access to our network even before I got here. And it was really very slow adoption. I'm talking about the patient being able to plug into the network and get their data. And for a while, we were sitting there around 5%. 5% of our network was responding. And one day we realized that all the work we've been doing to convince the provider side and the provider's vendors that connections this way are safe, secure, and beneficial, we saw a jump from 5% to 17% happen in this 3-month stretch. And I'm incredibly encouraged by the fact we saw that jump, because I do firmly believe that the next phase of healthcare, there's AI and all that and that stuff. That's wonderful. But we need the patients connected. And I'm excited to see that it started to get momentum. And to give you, just to tie that kind of AI thing together, think about it this way. The AIs are being trained by data. And my individual data doesn't matter that much to the training, because I'm a one of thousands, millions, billions of records. But they're trained by those records. But in the end, what that AI is going to do is help diagnose the individual, which is all about only my data. And what we got to be careful is these things are going to get trained. And if there's dirty data in my record, it might send the advice down the wrong clinical path. The example that I have, again, I observe what's going on, is I supposedly in my record got an HPV vaccination a couple months ago that I never had. It was just a mismanagement of the record. Someone typed in the wrong screen, and it's not a major harm to me in that episode where I'm in the hospital, for example, for the asthma attack. They'll look over that. But you don't know 20 years from now, when I have some other chronic or some episode that's very dangerous and they want to apply a therapy, what if that therapy is contraindicated? That says you can't do this therapy if the person has an HPV vaccination in their system from the past, and just skips over the wonder drug because the data told the AI, you have to skip that therapeutic option because the person has something that they didn't actually have. So you want that out of the record. It's kind of like you're trying to get a house and it says, for your loan, for your mortgage, that you're a risky person with a bad credit history because your data file, your financial history is garbled with stuff that isn't really from you. Like you don't want to find out as you're about to close on that mortgage that it's a 9% interest rate instead of a 6 because they got your financial history wrong. So getting patients engaged in their data as early as possible to be able to catch errors and interact with providers, I think is critical for us to be able to move to a more digital focused healthcare ecosystem. And I'm proud of the fact that the Alliance moved. And I do think I was a direct cause of that in terms of championing and discussing the problem and the why.
Wonderful. So that's a wrap. And thank you so much, Paul, for joining us today and sharing your insights on the CommonWell Alliance. And it's really inspiring to see how your life incidents motivated you to make change so that others don't have to go through the same. And it was an honor to have you as our guest today.
Well, thank you very much. It was my honor as well.
Thank you so much. So that was Paul Wilder, Executive Director of CommonWell Alliance. I hope you find this interview insightful. For more such interviews, stay tuned to TALRadio, powered by Touch Your Life Foundation. And this is me, Saankhya, signing off for today. Take care, you all.